Dr. Divya. Our next presenter is Dr. K.S. Kumar, and he'll be presenting his video on bash from trash, improvisation and upcycling in ophthalmology.
Good afternoon, everybody. I am Dr. K.S. Kumar. I've trained from PGI Chandigarh and Shankar Nethralaya and currently in solo practice in Bangalore. The objective of my video is twofold. One is there is an urgent unmet need in the field of wet lab training, and the existing models suffer from inherent defects of cost and accessibility, and I have devised an easily available do-it-yourself model eye and use tissues innate to the eye itself to practice this. And some of the situations may happen episodically, such as a drop nucleus, etc. So how to overcome these? And the other thing is how to use seemingly useless material. Can I have this?
This video is based on the concept of best out of waste and illustrates how discarded or seemingly useless material can be harnessed and improvised to serve useful purposes. Silicon bits from encircling band remnants, buckle bits or old silicon phaco tubings can be cut and packed in microwave compatible wax or oil paper. This paper may be obtained from the back of eye drapes. These can be heated in the microwave for about 30 to 45 seconds. As silicon is resistant to temperatures from -55 degrees to 300 degrees centigrade, it retains heat or cold and can be used in appropriate settings such as an eyelid style for either hot fomentation or cold packs. Small packets containing silicon bits may be given to patients who would benefit, as this retains temperatures for up to 2 minutes. Nuclei of varying degrees of hardness removed during SICS can be usefully harnessed. Placing these in a plastic ball or a small unripe lemon to simulate a model eye, and then trying out phacofragmentation can be a good initiation for the trainee vitreoretinal surgeon before embarking on real-life situations of dealing with dropped nuclei. Here we are visualizing a dropped nucleus being brought up into the mid-vitreous cavity by suction inside the lemon by a fragmentome and being force-fed into the fragmentome tip with a light pipe. Perfluorocarbons are expensive and are usually discarded after evacuation from the eye post-surgery. However, used perfluorocarbons can be stored and utilized for floating up nuclei in model eyes. The technique of floating up the nuclei and the need to axialize the nuclei, which tends to drift off towards the eye wall, can be practiced. The anterior face of the perfluorocarbon liquid tends to assume a convex configuration because of its density and surface tension. The same may also be tried to float up damaged IOLs with cut haptics or even sample IOLs. This gives a dry run of managing dropped nuclei or IOL. Similarly, silicone oil removed after surgery can be used each week on the joints and fulcrum of hinged ophthalmic instruments to decrease rusting, stiffness, and difficulty in opening. The polyethylene blisters of IOL packs or suture packs may be cut to suitable sizes, ethylene oxide sterilized, and kept handy to facilitate AC IOL insertion. This helps smooth insertion without iris billowing, or malpositioning of the ACIOL in the AC, and may be withdrawn after insertion and proper positioning of the ACIOL. This do-it-yourself sheets glide can also be used for safe placement of a rigid IOL in the sulcus when the PC rent is large. Inadvertent fracture of the trailing haptic during IOL insertion is a regular problem. This would necessitate IOL explantation if the trailing haptic is fully cut from the optic. But if a stump of the trailing haptic is left, a silicone sleeve may be slipped over the stump after trimming it to size along its long axis to enable insertion of the same lens as is shown in this video. An exact length of the silicone tubing equivalent to that of the cut portion of the haptic can be placed over the cut end of the haptic, and this is reasonably stable as is seen from this traction test. This avoids meddlesome anterior chamber maneuvers during explantation. A PC rent and a need for anterior vitrectomy is a specter that always looms for an anterior segment surgeon. Instead of making one's debut with anterior vitrectomy under duress in a real life situation, eye bank eyes may be used to practice vitrectomy in the lab with any used tricot and a used vitrectomy probe to mark the vitreous strands, and this gives a feel and sight of real anterior vitrectomy. Trypan blue stained anterior capsular fragments during cataract surgery may be retrieved and used as an ILM to simulate ILM peeling. Both the lens capsule and the ILM are made of type 4 collagen and have an elastic consistency. Thus, the lens capsule is a good substitute to learn ILM peel. This helps in depth perception and also helps refine movements involved in the delicate maneuver of ILM peel. A wrist weight or a wristband helps stabilize the wrist in this delicate maneuver for beginners. 50 Dacron suture remnant bits can be passed through the rind of a yellow lemon to simulate episcleral sutures needed for scleral buckling. Passage of the needle through the rind can be visualized as is needed while passing the needle through the superficial sclera during scleral buckling in a lift and advance technique. This can be a useful prelude to learning scleral buckling surgery. In conclusion, this train to an ideal world is via this tricycle of reduce, reuse and recycle. The maneuvers and methods described greatly facilitates learning, and the endless ways in which we can utilize some of these materials are only limited by one's imagination. Thank you very much for your forbearance.